Hello, my name is Kristen Eden, and I'm a dual-enrolled ASN/BSN student at Mercy College of Nursing and Health Sciences. In this presentation, I will be discussing reducing hospital-acquired infections, specifically central line-associated blood infections, otherwise known as CLABSIs. CLABSI and other hospital-acquired infections haunt the healthcare system by increasing hospital and patient costs, resulting in expensive antibiotic therapy and death due to sepsis. The high risk of CLABSI infections in ICUs. Patients in intensive care units are at high risk of contracting CLABSIs, as CLABSIs in ICUs are associated with prolonged length of stay and substantial mortality. Centers for Disease Control reports 90,000 CLABSIs occur annually in the United States. The use of education to reduce CLABSIs in the ICU. The CDC recommends educating and training healthcare personnel in the prevention of CLABSIs by incorporating bundled strategies for maximizing patient safety throughout the course of treatment. The purpose is to improve registered nurses' knowledge of evidence-based practice guidelines to decrease the incidence of CLABSIs. The use of an infection model in CLABSI reduction. CLABSIs remain an important cause of morbidity and mortality in ICUs, particularly in developing countries. Data shows the incidence rate of CLABSIs in ICUs in developing countries was 3 times higher than the U.S. CLABSI reduction with chlorhexidine. To prevent CLABSIs, this study evaluated the effectiveness of bathing on adult patients with central lines in an adult-only ICU by using 2% chlorhexidine gluconate for daily bathing on antimicrobial impregnated catheters and chlorhexidine impregnated dressings. The use of care bundles and reducing CLABSI rates in the ICU. Healthcare-associated infections are the most common complication in hospitalized patients worldwide. CLABSIs threaten patient safety, resulting in extended hospitalization time and increase in mortality rates and treatment. HAI's prevention studies indicate that it is possible to eliminate hospital-acquired infections by applying the bundled interventions which have demonstrated effectiveness in prevention of CLABSIs. This topic is important as healthcare-associated infections are a significant and unresolved issue in the hospital environment. This study states that CLABSIs may be the second most preventable cause of hospital death. Patients with CLABSIs are more than twice as likely to die as patients without CLABSIs. This subject is important to the public as CLABSI rates affect 1.4 million people around the world every day. CLABSIs occur in 5 to 15% of hospitalized patients in developed countries and over 25% in developing countries. More than 75% of these infections include catheter-associated urinary tract infections, ventilator-associated pneumonia, and CLABSIs. This is important to the healthcare system as CLABSIs infections can lead to morbidity and mortality in ICUs. Healthcare-associated infections threaten patient safety due to the long hospitalizations and the great expense in treating these infections. This is important to patients or the subjects as healthcare-acquired infections, including CLABSIs, are the most common complications in hospitalized patients worldwide. The ICOT statement states for patients in the hospital setting with central lines in place, does using a care bundle to reduce infection rates compared to not using the care bundle have a reduction in infection rates. As this is not an actual study or project, time is not required, but try to add a time frame for the intervention. The next step was selecting 5 articles that supported the PICOT statement. I selected the Sanal Complete database with full text. From feedback I had received, my initial search was too broad, so I used 2 additional search terms to narrow my search. The search terms and Boolean operators that I entered to narrow my search were CLABSI and prevention and infection and ICU. This gave me 127 results. To narrow my search further, I used the selection criteria Academic Journal, 2014 to 2018, English language, United States, full text, and inpatient. This provided relevant results that matched my PICOT statement. I then selected 5 articles. These included 2 meta-analysis, 2 quasi-experimental, and a well-designed non-experimental design. There are some key reasons for selecting each of the 5 articles to support the PICOT statement. The first article I selected was a meta-analysis conducted in 2014 on the impact of self-reported guidance compliance. This was chosen as this study sought to examine self-reported compliance with 5 evidence-based CLABSI prevention and link campaign to CLABSI rates in national patient safety collaboration. A 2015 well-designed non-experimental design was selected as it evaluates improving registered nurses' knowledge of evidence-based practice guidelines to decrease the incidence of central line-associated bloodstream infections through education and training nurses to maximize patient safety. The purpose is to develop an education intervention guided by the healthcare framework to improve the RN's knowledge of evidence-based practice guidelines to decrease the incidence of CLABSIs. Next was a quasi-experimental design performed in 2014 of a central line-associated bloodstream infection in a trauma ICU. This study aimed to assess the impact implementation practice recommendations in reducing central line-associated bloodstream infections in an acute trauma ICU. Next was a meta-analysis in 2016 with bathing with chlorhexidine gluconate, the evidence and costs associated with CLABSIs. The objective of this study was to conduct a meta-analysis and clarify the effectiveness of 2% chlorhexidine bathing by nurses on CLABSIs in adult ICU patients and to determine the contributing costs attributable to CLABSIs and 2% chlorhexidine bathing. Last article I selected was a quasi-experimental pre-test post-test design study, the efficacy of a care bundle to prevent multiple infections in the ICU. This study evaluated the efficacy of a care bundle aimed at preventing 3 most frequent ICU-acquired infections and to determine if using a care bundle on patients will reduce this rate of infection in the ICU patients. Studies found that CLABSIs can be prevented by consistent use of the practices in the CLABSI prevention bundle. These programs have demonstrated success in increasing compliance and eliminating CLABSIs. Using all practices in the CLABSI prevention bundle consistently, particularly those with lower compliance rates, is crucial for future efforts in reductions of CLABSIs. Use of evidence-based practice decreases incidence of CLABSIs. Prevention studies indicate that it is possible to reach a target of 0 in hospital infections by applying bundled interventions, which have demonstrated effectiveness in the prevention of certain hospital infections and improving patient safety. Reduction in the number of CLABSIs through measures such as care bundles and prevention models had a great impact on reducing the infection risk in ICUs. Integrations of care bundles is critical in intensive care patients, especially when compatibility is maximized. Care bundle effectiveness increases and leads to decreased mortality and morbidity rates. The use of CLABSI tools such as hand hygiene and chlorhexidine have been reported with successful outcomes in decreasing infection rates. Proper policy and practice to reduce CLABSIs should be standard of nursing practice. Necessary to use infection control programs in the prevention of frequent CLABSIs. Organized training programs prevent infections, leading to a decrease in infection rate, which indirectly confirms the importance of theoretical information. CLABSIs increase morbidity, mortality, and treatment cost. By implementation of care bundles, this creates an important opportunity to deliver evidence-based, safe-handling healthcare to patients with using a multidisciplinary approach. The results show care bundle effectiveness increases and leads to decreased mortality and morbidity rates overall. Inconsistencies. Studies suggest that self-reports on guideline adherence may be overestimated. It is likely that the responses may be based on more recent memory with poor recall. The study results from this analysis may not be generalizable to all ICUs. Even with the use of chlorhexidine products, CLABSIs can also occur because of inconsistencies in hand washing, catheter technique, and asepsis measures during insertion. In the studies reviewed, blinding of staff may not have occurred in all of the studies. Inconsistencies with CLABSIs. there was a failure in recording the dressing dates and properly administering the dressings. This revealed the highest incompatibilities within the study. Gaps. In CLABSI prevention, the questions and their response options used to measure compliance were modified in the middle of the program. The actual result of infection rates were not included. The results in terms of whether or not there was a change in the infection rates for ICU patients was not listed. In this study, there was a lack of distinction between which intervention had a greater or lesser impact in terms of which one may have helped the most or least overall. The only intervention stated for hygiene in CLABSI preventing was bathing with chlorhexidine. No other interventions such as dressing changes were mentioned. It is not differentiated whether or not individual aspects of the care bundle might be more or less responsible for the results found, but rather judges the bundle as a whole single intervention. Limitations. The results might not be applicable to all adult ICUs in the United States. Only data from adult ICUs participating in a specific improvement program were analyzed. Another limitation is that the questions and their response options used to measure compliance with CLABSI prevention practices were modified in the middle of the program. Next, there was limited to only RN knowledge. This study only assessed the overall knowledge of the RNs and not the actual results. A set of 3 interventions was condensed into one for the study. The study groups were 3 interventions into one for the purpose of their study. They used the removal of unnecessary catheters, education, and use of a catheter cart in one. Data limited to one source of cleansing. They only examined the data regarding the use of chlorhexidine gluconate in the bathing of patients. The study was broader than only CLABSI research. The study covered other problems and issues other than strictly CLABSIs. I do believe there is evidence to appropriately determine through infection prevention, CLABSI infection rates will decrease. There is no current specific guidelines. The guidelines on this topic are on the testing for infection, and the evidence in the articles I selected was focused on prevention. Meta-analysis supports a significant reduction of CLABSI incidence rates after implementation of basic practice recommendations. By using all practices in the CLABSI prevention bundle consistently, particularly those with lower compliance rates, is critical for future efforts to reduce CLABSIs and improve patient safety. Improved outcomes in nursing. These results will assist nurses with best practice and tools to prevent CLABSIs. It is necessary to use infection control programs efficiently to prevent or at least decrease the CLABSI frequency. Nursing can make a robust transformation in patient safety and infection prevention. Thank you for your time.